Thank the gentleman. Now yield to the gentlelady from Minnesota, Ms. Bachmann.
Thank you again, Mr. Chair, and also Ranking Member Towns. One area to look for fraud is with the Medicaid providers. Another is with the Medicaid or the managed care organizations. And this would be a question for Dr. Bedetti, if you will. And just briefly, based on the concerns that the managed care organizations are using Medicaid premium dollars to cross-subsidize other non-Medicaid State health plans, could you tell the committee what data you are gathering to combat these allegations, if any?
So, Congresswoman, I think that you are aware that in your State, in Minnesota, that after discussions with CMS that have been ongoing recently, that Minnesota has recently agreed to repay to CMS the appropriate Federal share of the amount of money that was contested, and we are currently reviewing the State's submission on that matter and have every intention of collecting the appropriate Federal share. We are also looking
But if I could ask Dr. Bedetti, how are they coming to the conclusion of what number? Because my question is about what data are you gathering so that we can be confident that States aren't taking Medicaid dollars and then using them for a cross-purpose to subsidize a non-Medicaid, non-Federal Medicaid State health plan? What specific data are you asking the States for so we can be assured this isn't going on?
I think that that question is very well taken. I think that we need to continue to build our capacity to collect the appropriate data on managed care operations.
So we aren't collecting any data to that effect today?
The emphasis has been on the fee-for-service side. I agree with you on that.
So we need to do better, it sounds like.
We do need to do a better job in terms of getting that degree of oversight.
Thank you.
And we are engaging in doing that.
And I agree. I think that shows a big hole that we have because we're not even asking the right questions. And I think that goes to Ranking Member Towns. The right question was asked of him at 1:30 in the morning. That's what we need to be doing, asking the right question. Clearly, we're not. Let me ask you also, Dr. Bedetti, since 2006, CMS has now spent over $100 million developing the One Program Integrity System to merge Medicare and Medicaid data. And the Medicare data has been collected, but to date the Medicaid data has not been included. Now, this is significant. It's been 6 years. Why is that the Medicaid data is not included, and what role should the States play in, or are they perhaps in delaying the collection of this data, and are States withholding information from CMS?
We certainly recognize that the data that we have been getting from the States are not adequate, and that's been at the core of our restructuring of the National Audit Program. We've been working very diligently over the last couple of years to improve that situation and to get the right kind of data. There's a demonstration project going on with 10 States that's designed to look at the data that we're currently collecting, to identify the data that we do need to do proper oversight, and as well as a number of other program operation requirements at the Federal level, and then to get those data from those 10 States and to use that as a model for improving the flow of data from the States.
Well, I would agree, but that doesn't answer my question why for 6 years we have Medicare data, but we don't have Medicaid. There's just an absence. So the question is the State holding out on us? Are they not giving the data? Are we not holding them accountable? So if you could get back to the committee and answer that question. I just have one question for Ms. Yoakum, if you could answer that also in the brief time I have. The GAO lists Medicaid as a high-risk program, and GAO has previously issued reports that address CMS's lack of oversight into Medicaid managed care rates. So given that we have 3/4 of Medicaid beneficiaries enrolled in some form of managed care, could you speak to the data that's used by GAO and CMS to address this aspect of Medicaid?
Certainly. Right now, one of the big issues across the Medicaid program are the different data systems and the extent to which they actually talk to each other. There are two different ways that managed care data may be collected. One is through its expenditure system. The second is through a separate accounting system that looks at the managed care reporting itself. Our work that we looked at on actuarial soundness and Medicaid managed care, we ended up going back to state plans and to states' contracts with managed care plans in order to understand CMS's review and oversight in that area.
And Mr. Chairman, I thank you for indulging me to be with the committee. It seems to me that there's a real problem in that we aren't asking the right questions. And I think we'd be a lot farther down the road if we ask the right questions. That's the purpose of my legislation that I'll be introducing shortly. But I thank the committee so much for graciously allowing me to be here today. And I thank Dr. Bedetti for getting the answers to the committee to the question that I asked.
I thank the gentlelady and Dr. Bedetti. If you would follow up in writing to the committee for the record in response to Representative Bachmann's questions. And I think the focus that you've touched on here and Ranking Member and I were speaking about is so important that unless we have that data, we really won't be able to get to the root causes. And what I talk about internal controls, ultimately our goal is to get to the root causes of the improper payments, the fraud, the misuse of funds. But without the data, it's hard to know exactly where that is. So that focus, especially on the Medicaid side, is going to be so important to ultimately reducing the improper payment numbers for both Medicaid and Medicare. So I thank the gentlelady for participating. Now I yield to the gentleman from Virginia, Mr. Connolly, for 5 minutes.
I thank the Chair. And I might ask my colleague who's joined us and welcome her to the subcommittee. She indicated that we're not asking the right questions. Because I'm late, if you would indulge me, what, pray tell, is the right question?
Well, I think the question is we want to have an independent third-party audit of where the payments are going. Today.
You mean the improper payments?
Thank you. That's a better way to phrase it, and I thank you for that correction for the gentleman. We have not conducted for decades independent third-party audits of the states. We aren't asking the meaningful data. In our state of Minnesota, for instance, a bill has been presented from managed care organizations to our state of Minnesota. The state pays it. It's almost like if you went to the grocery store and you had maybe what you thought was $35 worth of groceries in your grocery cart, and then the cashier said, please give me $300. And you said, well, let me see the grocery tape so I know what I'm paying for. And the cashier says, no, I'm not going to give you the grocery tape. Give me $300. We at the Federal Government aren't demanding the itemized statement of what the managed care organizations are charging the states, and then the states are passing that bill on to the Federal Government.
I thank my colleague.
We're just paying it. So thank you.
Thank you very much. Appreciate it.